where we celebrate and praise those wonderful individuals who are truly making a difference in our communities. I'm Gary York, and I'm grateful for this opportunity. We also want to thank Wilkes Communications, River Street Productions, and 100.9 WIFM Radio for this opportunity. Our featured guest today is Heather Murphy. She's the Executive Director of the Health Foundation. And we're going to start our discussion with Ms. Murphy, who's going to share her growing up and training before coming to Wilkes County. And good morning to you, my friend.
Good morning, Gary. Thank you for having me this morning.
Go back to Ohio and share your legacy there.
Well, let's just start by saying I got to Wilkes County as quickly as I could. I moved here in 1979 after graduating from Ohio University in Athens, Ohio. I studied magazine journalism there and had a great educational experience. Athens is part of the Appalachian region, and so Wilkes County and Athens have a lot in common, and it felt like home the minute I arrived here.
So expand on some college and a little bit of that training. Just tell us about more about
So the School of Journalism at Ohio University is a nationally accredited program. I studied magazine journalism, and one of the things that I did back when I was in school was as a volunteer, I worked for the Appalachian Regional Commission. And of course, the Appalachian Regional Commission was designed to help rural Appalachian communities strengthen their health and their economies. And I actually wrote a series of health columns teaching people how to live a more healthy life. And that was one of the inspirations for my later going to work for the Health Foundation, which we're going to be talking a lot more about today.
I'm looking forward to that. In 1996, you made a career change, and you heard about this great opening, and I'm sure there was a mutual attraction of the Health Foundation looking for you and me looking for the foundation.
Well, I'd like to think so. It was rather interesting because I had owned my own businesses. Some folks might remember Thursday Magazine. It was a TV and entertainment guide that we distributed free to everyone in Wilkes County. I also had a commercial printing business with my partner, and I had done that for about 13 years, but I was working really long hours, and I wanted more time with my young family. My husband, Tim Murphy, and I have 3 children that are all Wilkes County natives and grew up here. And so I sold my businesses and was looking for what I feel was to be my calling, where my talents and my interests could intersect with what the needs of the community were. And it was actually my minister's wife who told me about the opening with the Health Foundation. I knew some of the folks who were on that wonderful board of directors, and feel very privileged and blessed to have been given this opportunity. I've been with the foundation now 20 years.
Wow. All right, let's go to the foundation. And it started in 1991, and that tremendous asset to our community. And how did it get going?
So I want to give a big shout out to my friend Alvin Sturdivant Jr. He is the founder of the Health Foundation. He served as its first president. He had been on the board of Wilkes Regional Medical Center back when it was Wilkes General Hospital, and he really felt like the community needed a way to express its gratitude for living in this wonderful place. Sure. And having the wonderful doctors and nurses and people who care for us in our most fragile times of need. And so he formed the Health Foundation. He recruited some of the greatest leadership that existed in the community to form the organization and to ensure that there was always a local organization that would care about and nurture the health and well-being of the people of Wilkes County.
Wow.
Great visionary, delightful man, still enjoying his health, and just a vibrant person at age 90. So
Is he?
He is an
right.
inspiration to all of us, really and truly.
In a couple prior conversations, we talked about the vision of the board. And one of the initial moments, I suppose, was West Park. And what a legacy, what an incredible venture, if you will, or just tell us about West Park.
So when I moved to Wilkes County in the late 70s, West Park was the hub of this community. You know, there were restaurants and grocery stores and pharmacies, and it was a happening place. The Kathy Bogus Muscular Dystrophy Drive was held there each year. I got to be on the radio live down at West Park. It was just a great hopping place. By 1996, it was very much a blight on our community. I remember one of the realtors saying to me that if she was showing someone the community, she would drive through downtown North Wilkesboro, take them to the hospital, and then she'd drive back through North Wilkesboro all the way around to Wilkesboro because she didn't want to drive by that bottom land that looked abandoned and declining. Again, our board of directors had great vision. One of our earliest endeavors was to attract physicians to the community. And we realized that that was it was a quarter of a mile from our hospital. It could be a place of health and healing, and a place where doctors could come and practice medicine. It'd be convenient to the community, convenient to the hospital, and it just has a wonderful energy about it. You know, it's just, Mulberry Fields has a long Native American tradition there, and so it's just a very special place.
Heather Murphy, you were talking about the role you played, and with no experience whatsoever in real estate and acquisitions, but you found a way. You learned how to do it.
So again, kudos to the board of directors for giving me the tools that I needed to be effective. Now, certainly I had strong communication skills. I had a love and passion for this community, and those were two of the secret ingredients that I brought with me to the Health Foundation. What I didn't know how to do was to organize a campaign and encourage the community to support the vision of the board in the way that it deserved. And they were wonderful to provide me with some folks who could teach me how to do that. Today, I'm actually a certified fundraising executive. I have credentials that speak to my ability to bring people together and help them share their hopes and dreams in a way that they know their charitable contribution really will make a difference in the community. We always ask 3 questions. How much are we doing? How well are we doing it? And is it making the difference, the positive difference that we want to see in our community? And when we hold ourselves to those 3 questions, we know we're on the right track.
In your annual report, I love a statement about community partners.
Yes.
Embrace that for a moment, if you will, about how important that is.
Well, Gary, I love that you use the word embrace, because we talk about our partners being in our hug. This work is complex. There are a lot of problems in the world that are pretty simple. I can go into my kitchen and I have a problem that I have a desire for a chocolate chip cookie, and I can make that recipe and I can produce those chocolate chip cookies. And once I learn how to cook, that's pretty easy. But when you're trying to change lives and save lives, you can't do that on your own. The Health Foundation can't do it on its own. You or I can only be responsible for our own health and make the best choices we can. But really and truly, our health and well-being is about where we live. It's about where we work. It's where we play. It's where we learn. It's where we pray. And so if we don't have the people who can influence those aspects of our life on our team, we can't be as effective as we can together. There's great wisdom in this community. There's great energy. There is a spirit of collaboration. And so one of our roles is to bring together folks from throughout the community, folks like the people who are watching this show right now, because anyone can be an important component of our work. Bring them together, help them find their place in making a difference in the community. So we work with our school system, our community college, our hospital, our health department, our physicians, our YMCA. We have over 50-some partners who are helping us envision a place where every child, every adult is safe, is healthy, and is able to thrive.
Wow. One of the first initiatives was a kidney dialysis center, and a driver, an EMS driver, shared just a miracle, I think. Share that with us.
So, access to healthcare is very important in a rural community, and back in 1995, in December, there was a huge winter storm. And an EMS driver knocked on my door. I'd been on the job all of 2 days, so I can't take any credit for the great work of the foundation. But he came in and he said, "Mrs. Murphy, I just wanted to thank the Health Foundation." He was responsible for helping people who needed kidney dialysis get to their appointments. And at the time, prior to the Health Foundation bringing kidney dialysis services here, folks had to travel to either Hickory or Winston for that life-saving treatment. Well, thanks to the generosity of our donors and the leadership of our board of directors, we brought that service here, and it's still thriving and growing down at West Park. At the time it was at our hospital. He said, "Mrs. Murphy, it was all I could do to get folks to the hospital. I never could have made that trip to Hickory or to Winston." He said, "Your program saved lives this week." And how gratifying to know that you send in $25, $100, $1,000, and you've saved someone's life. What greater gift could we give this community?
And then giving what we receive.
That's right.
We get the comeback.
We never know when an accident or an illness or a diagnosis that changes our life is going to come our way. None of us are guaranteed a pass, where we enjoy great health all the time. What we really hope for is that when that happens, we get the excellent care that we need. My husband is a cyclist. He wrote the book Road Cycling the Blue Ridge High Country. And one day he was about 100 yards from our house when he and a dog had a collision. And he suffered life-threatening injuries that day, 100 yards from our house on his bicycle. If it weren't for the care he received at our emergency department, and our donors helped expand the emergency department, helped recruit our wonderful physicians who helped care for him that day, helped provide scholarships to the nurses who were providing his treatment. If he had not made it safely to the hospital and then safely transported to our wonderful partners at Wake Forest Baptist Medical Center, my children might not have their daddy.
Wow.
I might not have my husband of 32 years. So healthcare is really important to all of us, whether we realize it or recognize it or not. It's like water that comes out of the tap. We take it for granted, but it is a life force in this community.
Yeah. Heather, expand on the funding side, the money that, and I also want you to talk about clients that have businesses in the park.
Okay.
How many folks are domiciled there, if you will?
Okay, so the Health Foundation really has kind of a triple bottom line mentality. And, most businesses think about the bottom line being the money that they take in, right? Because no money, no profit, no business model, you can't survive without having an income for what you do. So the bottom line on the money side is one bottom line. The other bottom line for the Health Foundation is our mission. Are we doing what we say we are going to do? Are we improving lives? Are we saving lives? Are we changing lives? And to us, that is every bit as important as the financial side. The third bottom line is really about the stewardship of the earth and the stewardship of what's given to us, the property and the environment that we live in that's so important. So we had a very visionary board that said we want West Park to be a place of healing. We want it to be a place that attracts medical doctors and other programs and services. But we also want to make sure that we're fulfilling our financial obligations. So if you are a for-profit business that has a business down at West Park, you are going to pay a market rent. You're going to pay what it's worth to be there, just like if you were, at the Walmart shopping strip. But our nonprofit partners, our hospital, our public health dental clinic, the Ruby Purdue Blackburn Adult Daycare Center, all pay something because we believe everyone should share in the weight of things.
Right.
But they pay a much reduced rate, and that is one way we can return back to the community. And then we recently worked with the North Carolina Forest Service and the Virginia Tech Design Assistance Center. And they came in and helped us create a master plan for West Park that includes an adult exercise playground for people to be able to work out for free without having to join a gym or to be, a member in a club. We're going to have healing gardens and places where people can really find calm and respite at West Park.
Right.
So, let's take the dental clinic. The Health Foundation helped raise the money to build out their facility so that they didn't have to put money into light bulbs and furniture and equipment. The Health Foundation helped do all that so that they can put their money into meeting the dental care needs in our community. We helped them purchase the mobile unit, and it travels to all the elementary schools. And we repeated that with the adult daycare center, which is a wonderful place for people who cannot stay home alone during the day safely.
Heather Murphy, let's talk about the backbone. That's a concept that's new to me, and I'm sure a wonderful part of our community.
So the backbone is kind of an analogy for the work we're doing. All of us have a spine, and it holds us upright, and it keeps our body together, right? Yeah. So the Health Foundation serves as a backbone organization. We help hold the community together around health and well-being. This is part of a process that is called collective impact. It was designed by researchers at Stanford University who found that when communities were tackling complex problems, I talked about simple problems like making chocolate chip cookies. Well, that is a simple problem. You can follow that recipe, you can repeat that every time you turn around. There are more difficult problems that require more collaboration. Let's talk about, flying to the moon or going on the space station. That's a more difficult problem, but it's still something that if you follow the right steps, it should turn out the same way every time. Complex problems never turn out the way you necessarily think they were. I always think about my children. I have 3 wonderful kids. My oldest just had a birthday yesterday, and he is very different from my youngest child. And so parenting my oldest child and my youngest child were different experiences. One was a boy, one was a girl, one was kind of hyper, one was pretty calm, and then my middle child, a deep intellectual, very introverted and shyer than my other two children. It took something different to get good parenting for each of my children because the relationships were different and the children were different. So in collective impact, we've found that communities who are trying to solve complex problems, like how do we keep our children safe? How do we keep our children healthy? What do we do about the growing obesity rate? What do we do about the fact that a child born in Wilkes County today is likely to live 5 years fewer than a child born in Chapel Hill? That's unacceptable. But fixing that, there is no one silver bullet solution. We have to look for that silver buckshot. We have to put together all the different pieces that are going to make a difference for children in this community if we're going to solve a complex problem like that. The Health Foundation is committed to making sure that we're bringing people together around that we are communicating, and that we are sharing results. Because, we rely on charitable contributions for a lot of the work we do. Well, if I'm a donor, and I am a donor, I want to make sure that my money is being spent wisely. I want to make sure that what I give is making a difference. Remember I said, how much are we doing it? How well are we doing it? And what difference is it making? So we have developed measures. Accountability and transparency about what we want to see happen. And our partners have all agreed that we want to watch children's height and weight and flexibility and endurance so we can see that they're getting the physical activity they need to be healthy and that they're eating the right foods. We also want to make sure that fewer and fewer children are having to go into foster care because Wilkes County has a very high rate of children in foster care. They're not with their parents. And there are deep-seated reasons for that. And what can we do to change that? And so, collaborating and bringing people around the table to bring that collective wisdom into the room and to choose the interventions and the programs that we know can make a difference in the lives of these children is a very important component of the work that my staff and I are doing, and our board and I are doing in the Health Foundation.
You spoke about the meeting with Mark Bird today.
Yes.
And talking about an initiative that will be in
so
our
Mark
school
Bird
system
is our superintendent of schools.
Yes.
And we talked about the determinants of health, including where we learn. Our school system is an important partner in our work because our children spend time in school, and the adults who work there spend time in that workplace. And we want that workplace and that place of learning to be a healthy place where children can thrive. So we have a number of initiatives that we're working with our partners on at the school system. Chris Scabo is part of the active living component of our work. And he and our partners are putting a couple of programs into the schools this fall. Now, they chose these programs. We didn't. We don't do anything with people or for people without people. They are the drivers of this work. But they chose a program called Match. It will be in all of the 7th grade curriculi this year. It stands for Motivating Adolescents to Choose Health. And it has achieved remarkable results. It was designed by an educator in the eastern part of North Carolina. They teach kids the connection between what they eat, what they drink, whether they're moving or whether they're sitting there on their iPhones. And we've all done that, but there's a time and a place. It teaches kids that connection. The other program that we're introducing to the Wilkes County schools is a program called Spark. And it is being put into all of the schools in the PE classes. So we've got that going. And then Vicki Huger, who is head of nutrition, traveled with us to Arizona to learn new ways to have help children and families learn healthy eating habits even on a budget. We want to encourage people and teach people that healthy eating is no more expensive than unhealthy eating. It just takes learning and practice to be able to do that, like anything.
You also spoke about childhood trauma.
So we know that when children live in toxic environments, when they live in conditions where people yell at them all the time or call them stupid or ugly, when children are physically abused or sexually abused, when they live in a household where the family members can't give them their full attention because they are mentally unwell or they have substance abuse issues, even divorce. These are all traumatic experiences for children. And the good news is that there are ways to help children overcome that if we recognize it. And so our school system, Department of Social Services, and other partners are all working together to find ways to build a more resilient community, more resilient children, to overcome the adverse childhood experiences. And that's the ACEs, Adverse Childhood Experience.
Wow.
And, we know that we can turn around families and help people learn to live healthier, safer, more complete lives through this kind of work. It's really exciting, Gary.
It sure is, and I appreciate your enthusiasm and your encouragement and the ways that you're engaging our community.
Thank you.
Pull, and again, the partners, the community partners, the 52 partners, it's just an incredible experience for me to get to learn. So we want to thank again Wilkes Communications for this opportunity.
Yes, very
And
much so.
for,
They're one of our partners.
River Street Productions and WIFM. And as we draw to the end of this wonderful moment in our community, tell us how this opportunity for you, how it's enhanced and embraced in your life, is making you a better person as you make this community, as you lead this community, as confidence and courage and the great leadership skills that you have.
Thank you. So I always say that you cannot help someone else without helping yourself. You cannot enrich another human being without enriching yourself. Love given is love that returns to you in so many different ways. So to me, this whole experience of working with the Health Foundation feeds my heart, it feeds my soul, it gets me up every morning with a smile on my face. I have learned generosity from the most generous people in the world.
Wow.
I have learned financial accountability from some of the most brilliant financial people in this community. I cannot begin to express how deeply meaningful this work is to me.
It's a calling.
And how it is a calling. And how grateful I am to everyone who has contributed to our work, who's volunteered for us, who prays for us, who changes something they do every day to lead a healthier life.
And who gives to us.
And who makes charitable contributions to us.
Yeah.
So it's a gift to me to be able to do this work, and a delight to get to share it with you and the audience of Wilkes Communications. Thank you so much.
Thank you. This honor is, I think I could frame it by saying, in giving we receive.
Absolutely.
If you put a lot in, you get a lot back, and this community is a significant beneficiary for those who have servants' hearts and who believe in serving and are people of God. And thank you so much.
You're so very welcome. Thank you.
Let's do it again.
All right.
Thank you.